In this lecture, we are going to discuss how can we prevent ourselves from being infected by the hepatitis B virus. So basically, there are two methods through which we can prevent ourselves from being infected by the hepatitis B virus. First one is the active immunization, and second process is the passive immunization. Okay, so if we see here that two methods, first one is the active immunization. Active immunization. And second process is the passive immunization. So in the active immunization, we will use the vaccine. Okay. So basically in the vaccine, you will see the presence of the subunit of the hepatitis B virus, like the hepatitis B surface antigen. Okay. In vaccine, you will see the presence of the hepatitis B surface antigen. Okay. That is actually the component of the hepatitis B virus. Okay. But in the passive immunization, we will use the preformed antibodies, okay, in which we will use the hepatitis B immune globulin, HBIG, okay. These are in which you will see the presence of the hepatitis B surface antibody. In the vaccine, you will see the antigen, but in the passive immunization, you will see the presence of the antibodies, okay. So in the vaccine, you will see there are a lot of vaccines that actually use for the hepatitis B virus. So you will see first one is the Recombivax. Recombivax. Okay. Second vaccine that will be the Angerix B, and you can also see the Heplicef B. So here are basically the three most important vaccine that is actually used for the hepatitis B virus. Okay, Recombivax and the Angerix B is actually used in 3-dose regimen. You will see the 3 doses of the Recombivax and the Angerix B, and Heplicef is actually using 2 doses. There are 2 doses of the Heplicef. Okay, another important vaccine that will be the Twinrex. Twinrex, okay, that is also used for the hepatitis B, but it can also be used for the hepatitis A virus, because in the Twinrex you will see the presence of the hepatitis B surface antigen as well as inactivated hepatitis A virus. So it's mean inactivated hepatitis A virus. So Twinrex can be used for both hepatitis A as well as hepatitis B. Okay. So, but the question is how we will use this vaccine, or for what type of patient we will use this vaccine. So basically we use the vaccine, hepatitis B vaccine, for those patients who are frequently exposed to the blood or blood products, like the healthcare staff. Okay, first one you will see most important, healthcare staff, because in that case they are frequently exposed to the blood products like the surgeons and the dentists. Okay, you can also see those patients who frequently transfuse blood. Okay, transfusion of the blood in patients like the dialysis patients. Okay, and you can also use these vaccines for the intravenous drug users. Okay, but in the passive immunization, you will see the presence of the hepatitis B surface antibodies, and you will use the passive immunization for the accidental needle stick injury. Okay, for those people who got the needle stick injury, needle stick injury in that case. Okay, you can use the active immunization and the passive immunization separately, or you can use it in combination as well. So we will see how we will use the active or vaccine, or you can say immunoglobulin, at the same time. Most important thing which you have to remember about this, you will use the vaccine as well as the immune globulin at separate side of the body. If I say at different arms of the body, like you will inject the vaccine at the right side, and you will inject the hepatitis B immune globulin at the left side. Otherwise, vaccine and the antibodies will become neutralized if you inject at the same side. Okay. So in what situation we will use the vaccine and the immune globulin at the same time? That process is actually called the active passive immunization. We will use the active passive immunization in case of needle stick injury. Needle stick injury, especially if you infected by the patient who is actually hepatitis B surface antigen positive. Okay, and you can also use for the newborn baby whose mother are actually hepatitis B surface antigen positive. It actually reduces the transmission of the infections from the mother to the newborn. So how active passive immunization will give benefit to you as compared to the separate active immunization and the passive immunization? Because immune globulin will prevent you from infection rapidly, but the vaccine will give you long term protection. It will give the short term protection, and the vaccine will give the long term protection. Okay, and last, most important, so screening, that is the important thing from being infected by the hepatitis B virus. Blood screening is very much important. So in this screening, we will screen the hepatitis B surface antigen. Screening of hepatitis B surface antigen before the transfusion is very much important. Otherwise, you will see that hepatitis B virus transmit from one person to another. Okay, that is the important thing. And if someone infected by the hepatitis B virus, then that person will always be rejected for the transfusion of the blood. That patient cannot transfuse blood at any time of his life. Okay, that is the important thing about this screening. And screening is also very much important. If you see the chronic carriers, we can detect the chronic carriers by the screening. If you see that the presence of the hepatitis B surface antigen for greater than 6 months, then it will become the chronic carrier. So we can detect the chronic carriers. By detecting the chronic carrier, we can reduce the transmission of the hepatitis B virus from one person to another. And last, most important, that is the pre-exposure prophylaxis. That is the pre-exposure prophylaxis. We will use the different drugs before the exposure of the hepatitis B virus. That will be the Truvada. Most important, Truvada. That is the antiviral drug, in which you will see the combination of two drugs. First one is the tenofovir, and second is the amtricitabine. Okay, Truvada is basically the combination of two antiviral drugs, tenofovir and the amtricitabine. That is actually used for the pre-exposure prophylaxis for both hepatitis B virus as well as for the HIV, because these drugs actually inhibit the reverse transcriptase enzyme that is actually present in both hepatitis B virus and the HIV. So this is all about the prevention of the hepatitis B virus. If you still have any question, you may ask in the comment section. Thank you so much.